Let's talk about miscarriage, because miscarriage, unfortunately, is a fairly common event, and it usually occurs in the first trimester. About 15% of all pregnancies end in miscarriage, so that's about 1 in 6, and you can see that that's pretty common. The reason that people miscarry almost always is because when the sperm and the egg come together, the genetic information isn't transferred correctly, and so the baby doesn't have all the information it needs to grow. So what happens is it starts to develop, and then it runs out of information basically and just stops developing. Eventually the body realizes that the baby's no longer developing, and then it flushes everything out. If this happens very early in the process, it may feel just like a late period. But if the baby's more advanced when you miscarry, you can have significant hemorrhage, and it can be a much bigger problem. Generally, the way a miscarriage will present is first with spotting, then it'll turn into bleeding like a period, and eventually heavier bleeding. Now, there's sort of different categories in my mind of miscarriages. The first is what I consider what I call a chemical pregnancy. And what that is that the pregnancy tests these days have become extremely accurate, and we find out that women are pregnant very, very, very early. And so let's say that you miss your period by a day or two, you have a positive pregnancy, the next day you have a period that seems like a fairly normal period, maybe a little bit heavier than normal, and then you recheck your pregnancy test a week later and it's negative. Even though that's technically a miscarriage because you did have a positive pregnancy test, had we not had such accurate pregnancy tests, you would have just thought you were a couple days late for your period. So in my mind, that's not as much of sort of a real miscarriage as a miscarriage that occurs later on. The next category are miscarriages at more like 5 to 6 weeks, which is a fairly common time to miscarry. At that stage, at about 6 weeks, the baby should be big enough to be able to see a heartbeat on ultrasound. And so typically what happens is you have some bleeding, we do an ultrasound, and we don't see a heartbeat. At that point, if you miscarry, you're going to have pretty heavy bleeding, but probably not life-threatening bleeding. Now, if you get a little bit farther along, 7, 8, 9 weeks, when the baby stops developing, those miscarriages can be much more significant in terms of bleeding, and you can have very, very heavy bleeding. So that's just some things to think about. The medical term, when you have an impending miscarriage or when we see that there's no heartbeat and yet a baby has started to form, we call that a missed AB, is the medical terminology. And what that means is that the baby's no longer alive, but you haven't miscarried yet. And we're going to talk about some of the treatment options for when that occurs. But I want to talk about some of the misconceptions about miscarriage. Many people are worried that they did something to cause their miscarriage, and that's absolutely not true. You couldn't cause a miscarriage if you wanted. You don't cause miscarriages by working too hard. You don't cause miscarriages by eating too much or not eating enough. You don't cause miscarriages by exercising. You don't cause miscarriages by stress or by crying or being emotional. None of that will cause a miscarriage. It's important for you to understand because if you miscarry, there's no reason for you to feel guilty as if you did something to cause a miscarriage. Believe me, there's no intervention and there's nothing you could have done to change the fact this was going to happen because this was destined to happen the moment you got pregnant. So at least you can be comfortable to know that there wasn't anything that you did to cause this.